Hi, my name is Rachel Watkins Peterson. I am a project manager with the Respite Care Association of Wisconsin. We want to thank everyone for joining us today for November's monthly mini, where we are going to be discussing the Respite Care Provider Training. I want to welcome Val Madsen, RCAW's Training and Development Specialist, the brains behind Respite Care Provider Training, and she is going to share with us a wealth of knowledge today. So welcome, Val.
Thanks, Rachel.
Yeah. So thank you everyone else for joining us. We're just going to talk about the new revised Respite Care Provider Training, otherwise known as the RCPT. Need to have an acronym for everything. So Val, can you help us understand what is the national project that you speak of when you talk about the RCPT?
Yeah, so we are very fortunate to have been contacted and partnered with the Arch National Respite Resource Center, along with NASHP, which is I have to look at it because that's a long acronym as well, the National Academy for State Health Policy. And so the three of us are doing a huge project nationwide on really working on training, retaining, and recruiting respite providers, because there's a huge workforce shortage, especially for direct care workers. And respite, there's nothing specific for respite nationwide. And so with this team of the three agencies, we're really hoping to create a training program, recruit, and then keep providers throughout the state. So we're launching a pilot project really soon, January 1st. So we're really doing all the groundwork now, working with the 11 different states that are part of this project. And so the Respite Care Provider Training is a huge portion of the training part of the Respite Provider Recruitment Training and Retention Project.
Great. So when you say nationwide, I just want to point out to everyone that states applied to be part of this project, and I would like to congratulate those who were accepted. We're working with Montana, Kansas, Illinois, New York, Massachusetts, South Carolina, Arkansas, Oklahoma, New Mexico, and Nevada. So really exciting things happening with RCAW. So previously, RCAW had the Respite Care Certificate Program, and now it's the Respite Care Provider Training. Val, can you help us understand the difference between those two and the why behind the change?
Yeah, and we actually, a couple of years ago, we had a change to this program as well. It used to be called the Caring Network Training, and then we switched it to the Respite Care Certificate Program. And so just throughout the last 12 years, this training has really modified and updated to keep up with the times, which we're really excited about. The look of respite has definitely changed over the last 10 to 12 years. The need for respite has changed, and really this training has just updated to keep up with that need. So the Respite Care Certificate Program had 10 courses, which is the same as the current training, the provider training. And that what we did is we took those 10 courses and really looked at it instead of a Wisconsin lens, we looked at it as a nationwide lens. So we have some information that is specific to Wisconsin, but the bulk of the information is really looking at respite nationwide. So there are some changes where we talk about like circles of care and what might be included with respite. That's going to be different in each state. In Wisconsin, we're able to provide medications in some settings. Typically, respite providers provide all the personal care in Wisconsin. Other states, that's not the case. And so it's just really interesting, the difference in states. So we took our training and leveled it out where it fits each state, and then we can add in our state-specific information to give the information that people in Wisconsin need, or these other states can build it for their state as well. So it's really exciting. So that's the biggest change between the RCCP, the Respite Care Certificate Program, and the Respite Care Provider Training, is it just has more a national lens looking at it than just a Wisconsin focus.
Okay, great. So what courses are in the Respite Care Provider Training, and Can you help us understand a little bit more about the competencies in a work group that helped formulate those competencies?
Yeah, so let me pull up the course list. So there are the 10 courses, and really looking at, it tries to break, this is an entry level, base level training program, but with it, we've also had quite a few people take it that said they've been providers for years and they still learned information coming from this. So it really is good for people who are just starting up and have zero experience, or people that have been in the field, just, best practices or updating information. So the first course, what is respite? It talks about the definition of respite, benefits for the caregivers, benefits for the care recipients, benefits for family members, why people become providers, but then each state deep dives into respite in their state. So for Wisconsin, we talk about the funding sources, how to become a respite provider, looking at those types of things and what respite's like here. And then disability basics and client care, really looking at just kind of the basics of a variety of care that you might provide. We don't go into specific disabilities or conditions because you could spend hours and hours, and there's other trainings out there that do that really well. We want to give you that baseline information, and depending on the population you're working with, you might decide to get information in other places. Medication awareness, even if you, I apologize, even if you are not giving medication, it's still really important to have some awareness around how medications work and what that looks like. Safety procedures goes into emergency procedures along with abuse and neglect and incident reporting, specific for Wisconsin statutes. Caring for challenging moments, just really looking at some of those moments that are challenging for everyone, how to try to avoid them or how to get through them, and how to best support what the person is trying to communicate, because that's often why there's some challenges going on. Wellness, household, and respite activities. So really looking at meaningful activities. What does that mean for respite providers, and how do you provide those to the care recipient? And then ethics, interpersonal skills, really looking at how, kind of those interpersonal skills, because we don't really focus a lot on that, how to do active listening and some of the diversity and training, looking at, you might be in situations that are different than your beliefs. How do you deal with that? And then how to meet and develop that relationship with the caregiver and care recipient, interview questions. And then the next steps, this goes into how RCAW can support you, how it talks about self-care and topics around continuing education, but then also in Wisconsin, we talk about our Respite Care Registry, how to go on that, how RCAW can support you with different continuing education opportunities, fees for conferences, trainings that we have, support for our providers and for our families. So just really a variety of different topics. And within those topics, we have, let me pull up the core competencies. One really neat thing about this project is we had an expert work group, the nationwide, that was involved in creating and looking at competencies for lots of direct care professional training programs. So this would be personal care workers, CNAs, direct support staff, home health workers, and really looking at what their competencies are, but then focusing on respite. As a respite provider, what are some core things that would make me a high quality respite professional or a really good respite provider? And so we develop core competencies, and each of those courses that we have relate back to these core competencies. And so really looking at principles of respite, safety, planning respite activities, person and family centered care, cultural competency, ethics and professionalism, professional development, communication, relationship building, health, wellness, and self-care. So really looking at all of these things that can make you a high quality respite provider.
So if a respite care provider or someone, I think we would definitely want to point out that you don't have to have any experience. So Val did say that there are people who have taken people who are providers already and may have been providing care for a few years, a lot of years, when they still learned something from this course, which is great. But someone does not have to have any prior experience or knowledge in this. And so Val, what I'm hearing you say is if someone successfully completes their respite care provider training, they will have learned things that have met all of these core competencies of a respite care professional.
Correct. Yes.
Okay.
Yeah. And really, respite providers look lots of different ways. And this training tries to meet all of those needs, whether it's in-home respite, or maybe you are part of a volunteer program or church-based, faith-based organization program, and you're doing volunteer companionship care. This program will meet those needs as well. Or a lot of people that take our training are family members that just want to help out with a family member, maybe outside their household, and wants to be able to support that family in some way. So it doesn't have to be, respite care professional. That seems like a scary thing. We're not saying that. We're saying these are just kind of best practices, and this training will help you get some of those that baseline information to start working towards some of these best practices. And really, the overall goal for anything is providing the best care possible for that care recipient, so that family member can have a true break or true respite.
Yeah, and what a great thing to launch during National Family Caregiver Month.
It is, yes.
And hopefully giving family caregivers around the nation better access rather to higher trained respite care professionals. Bill, course 110, if you could scroll down, I believe it said next steps in the Wisconsin Respite Care Registry, or next steps in becoming a respite care provider. Do you talk about the Wisconsin Respite Care Registry in this course? And if so, can you also tell the listeners today what it's about?
Yeah, so in the Wisconsin specific course, we go into all the different ways that you could become a respite provider. Because maybe you're just starting out and you aren't sure where to find families to provide respite. And one thing that RCAW has that is a really neat tool is a way to connect family caregivers and trained respite providers. So people who have taken this training course is able to be on our respite care registry, so family caregivers can find them and reach out to them. And part of course 109, where it talks about meeting with the caregiver, we give you that information on how to make that a good and safe relationship on both ends. So things that you want to make sure you're asking so that you're being trained appropriately for that individual, so that you can be successful and that you have this open communication with the family caregiver as you continue to work with them. So that course, we really go into how to get on the registry, how to create a good profile, a high quality profile, along with the other things that RCAW is here for to support respite providers throughout this journey.
So thank you for that. So it kind of sounds like the registry is a bridge to connect people who need respite care to people who provide respite care. Is there a fee to be listed on the registry? Is there a fee to search the registry? And who's the employer of someone who has a registry profile?
Yeah, so there is no fee for this course. There is no fee for the registry. That's one thing RCAW wants, is all of our information, all of our resources is available for everyone at no cost. So it's a great free resource where it's not costing you any money. With the registry, it's really helping you connect. We're not doing anything more than that. So it's between you and the family caregiver to figure out that employment relationship. And we do go into that because some of our families that use it will pay out of pocket. Other families might be receiving funds through a county waiver agency. And so then we talk about what that means and how that affects you. And we also have additional training on if you wanted to be an independent provider so that you could be on the CLTS registry, or if you wanted to, which is the children's system, or if you wanted to receive funds from the adult system and what that looks like and how to start your own business as an individual. We do have additional training in that, and we talk about that in that course 110 as well. So we really just want to give you all the information you need so that you can create that relationship, successful employer relationship with that family caregiver. You're muted.
Awesome. I think we'd get this down by now. So I do have just, I think about 2 more questions, but while I'm asking, are you able to make me a co-host so I can share my screen to show viewers where to find this and a few of the other trainings I wanted to highlight? Yes. My next question for you, well, I completely put you on the spot. Thank you. How long does the Respite Care Provider Training take? How long should someone expect to need?
Yeah, well, and I don't think I even mentioned it's an online training. So it's not an in-person training and it's at your own pace. So the 10 courses you can start and stop as needed. The certificate that you get is for 7 hours of course time for the 10 courses. It typically, and it depends on kind of your speed of reading. There's videos that you watch throughout. So for some people, it takes less if you are a quicker reader. So 7 is kind of the very longest amount if someone were to really go through and process and take notes. You have access to all the information. So every PowerPoint, every slide, every link you have access to. So you can download that and you have that as a reference guide for you to take with you. So I would say probably takes people a couple days, not like all day, but typically people do it within 2 or 3 days, maybe 4 or 5 hours, but again, 7 hours is kind of that end time.
Okay, awesome. Now I'm just gonna, thank you for answering that, Val. I'm gonna share my screen really quick to show everyone where to find these trainings. So if you go to our website, so it's respitecarewi.org. Once again, respitecarewi.org. You would come down to free trainings and scroll down a bit. Now this is the Respite Care Provider Training that Val was just talking about. But we could spend all day talking about the trainings that Val has formulated, but the one that I do want to point out, for someone that did complete the Respite Care Provider Training, whether they chose to be listed on the Wisconsin Respite Care Registry or not, there is this free course, and it gives people, providers, materials and tools. So one of them is how to market yourself as a respite care provider, becoming an independent respite care provider. And so people can register for these free courses, work at their own pace. But I just wanted to point out all of these other links and resources that are state specific to Wisconsin. Something else that I would love to point out to everyone, RCAW, we do have grant funds for people who have been listed on the registry for 60 days. And what we really want to do is, with our mission to promote, support, and expand quality statewide respite care, to expand the pool of respite care providers that are trained, we do offer funds for continuing education for those listed on the registry. So I think that that's another way that we're able to support respite care providers, and the better RCAW supports respite care providers, the better that we're providing support to family caregivers. So it kind of comes full circle.
Yeah, well, and a great way to use those funds is for that disability specific training. So, taking the Respite Care Provider Training, and then maybe attending the autism conference or the Alzheimer's conference, or looking at other online trainings that cover specific populations is a great way to use those funds and build your skill knowledge as well.
So if someone were to complete the RCPT and they're listed on the registry for 60 days, they can request money for continuing education, but we don't have a preference if it's something that's virtual or a conference that might be in person. They can use it however they see fit.
Yes, for sure. We want it to fit the needs of the provider. So whatever makes sense for you as a provider and whatever continuing education would help for you, that is what we want to support.
Awesome. Well, Val, you answered all of my questions. I really appreciate your time today. Kelly, thank you for joining us. I'm not sure if you have any questions, Kelly, please feel free to ask.